in summary, throughout a woman's reproductive life, health maintenance visits need to occur on a regular basis. It's very important to determine the risk for disease. It's important for us to provide early intervention to prevent disease and optimize healthcare outcomes throughout the lifespan. So the nurse's role is to determine what risk factors are present based on a thorough health assessment, and this is through that health history and the physical exam. When a woman comes in for this annual exam, you are their first person that they talk to. Find out what issues are on her mind. Communicate these issues with the healthcare provider. When the physician or the nurse practitioner look at their schedules, there isn't a whole lot listed about what are the concerns that this woman has. It just simply says annual exam or well woman exam. So for them, it's very routine. We're going to go in, we're going to ask a bunch of questions, we're going to go ahead and do the breast exam, pelvic exam, pap smear, and say, you know, this is what you can use for contraception, or let's, you know, screen you for STDs, etc., etc. So if there is something that is really of concern for this woman as she comes into this exam, make sure you communicate that to the provider. The nurse is responsible for room flow, which means you are bringing the patients in, you're doing their vital signs and their weight, you are having them come into the room, have them get undressed if it's appropriate or when it's appropriate. You need to set up the exam room. So what we do is we have either a Mayo stand, which you've seen in the operating room, or we just set the equipment up on a counter. And this is the equipment that's needed for a pap smear. The equipment will include some type of speculum. There may or may not be a light source that needs to be with it. It depends on what type of speculum that the provider is using. The plastic speculums have a source that goes into the handle, whereas the metal source, we're going to use a light source that's hanging on the wall. We need to have the pap smear equipment, which is either going to be a cyto brush or a long wooden stick, a slide, or we're going to use the plastic container that has fluid, and that will look for HPV as well as cervical cancer. We need lubricating gel, and we of course need gloves. The nurse assists the provider with procedures. So once they obtain the sample, you may be the one who is rolling the tissue sample onto a slide or putting the brush and swirling it around in the fluid so that the cellular material is dispersed into the fluid, and then capping it and labeling the specimens. You will be the one that's going to put the gel on the examiner's fingertips. But another reason for having someone else in the room is as a chaperone, lest the provider be accused of some type of inappropriate behavior. Remember, this is a very sort of intimate exam, and a female is quite vulnerable when this is done. The nurse needs to label the specimens before ever leaving the room, and then send it off to the lab. One of the daily routines for the nurse is to review the results. So any type of serious abnormalities need to be flagged and presented to the provider immediately. The other ones can be set aside for downtime within the office for the provider to go through, sign off, make notes, and then you will oftentimes get instructions of how to communicate the results with the patient. Sometimes this is through doing a mail, it might be an email, or you might need to phone the patient and tell them how to proceed, especially if something's not normal. As the patient leaves the exam room, it is the nurse's job to reiterate the instructions that the provider gave during the exam. When you're in the room, you need to pay attention to what is going on, not simply to the procedure, but what is being communicated back and forth between the patient and the provider. And anything that is really important, you want to reinforce that education as this patient is getting ready to leave. Remember, you're a nurse. Patient education is a huge part of our job. Remember, every patient encounter provides the nurse with a teaching opportunity to make a difference in a woman's reproductive life. And this concludes the lecture on health maintenance during the reproductive years. Thanks for listening.